Hi everyone. I'm just trying to get my guest on.
Hi.
Hi. Okay, hold
Can,
on.
can you hear me?
Yeah, I can't see myself, but oh well. Hold on.
I can see you.
I know I can't see myself. I have the okay, I can't see myself, but
Oh, I lost you. Let me see. Hang on, everybody. I just re-invited her. Okay, there. Can you
okay.
hear me now?
I can hear
Okay.
you. I just still
Oh,
can't see myself, but we're all good. It's okay.
oh. Well, you
Hopefully
look
my hair is okay.
you look fabulous.
Okay,
Oh,
great. So nice to
so
see you again. Do people
so
know
great to
that we're
see
like
you. Not
old
really, so I'm going to tell
friends?
everybody. Hi, everyone. So excited to see everybody. Thank you for joining us. If you're watching us live, please say hi, make a comment. If you're watching us later, just type in hashtag replay. I am Dr. Prabakar from the TheFibroidDoc, and I have a very, very special guest today who I'm going to introduce in a second. Um, so Dr. Alyssa Hellman is with us from Wisconsin. Thank you so much for being here. And she and I go way back. We actually did residency together at North Shore, Long Island, Jewish Hospital in the North Shore of Long Island, where I feel like I got my honorary Jewish degree
Of course.
because,
Of
yeah,
course.
only to be followed by fellowship and Maimonides. So,
Oh yeah,
you
there
know.
you go. You're like tried and true for sure.
That's right. So she was actually my chief resident when I was an intern. And after residency, I don't really think we've kept in touch. But
Right.
recently, I rediscovered her wonderful work on Instagram. And so I'm so excited to be doing this live with her. Dr. Hellman is originally from New York. She went to NYU. And then, as I said, she did her residency in North Shore, LIJ. She practices now in Wisconsin. She does general OBGYN as well as a very special telemedicine practice where she helps Jewish women around special laws associated with the menstrual cycle. And she has a special interest in education amongst Jewish women. So I hope I got all that right. Is
Yeah.
there anything
Yeah.
else you want to say?
Yeah, no, I didn't remember if you were my intern as a chief or my second year, but all I remember is that you were super good. So,
Uh,
so I'm
yes,
good. Okay.
intern. So great. So, I made this title of this post, manipulating your period, and some of
Right.
you DM'd me and said, "Oh, well, oh my gosh, what does that even mean? Manipulate your
Yeah.
period, right?" And so also for those of you who are listening, if you're like, okay, Jewish laws, fibroids, what do all these things have in common? Hang in there, hang in with us. We're going to talk about it.
Yeah.
So, as a minimally invasive surgeon who focuses on fibroids, now I see a lot of women with, heavy bleeding and irregular bleeding. It's not just heavy, it's a lot of women have spotting at random times. And one of the biggest complaints that patients have is, oh my gosh, like, I was really wanting to go to that wedding and now like I can't because I'm having this irregular bleeding, or I just wanted one day to go to the beach and where I can swim and now I can't. So it's a big disruptor of like, their social life. And so this conversation, I'm hoping, can kind of talk about some of the work that you're doing around the Jewish laws and how that ties in, and then also about birth control and kind of how we can actually manipulate our period for certain special occasions. Does that sound good?
Yeah. Perfect.
Also,
Yeah.
okay, so I would love to hear a little bit more, for everyone listening, also like what your work is like right now, especially in the telemedicine world,
Yeah.
and if you can tell us a little bit more about these Jewish laws that you talk about.
For sure. Yeah. So I've been a generalist for a long time, 11 to 12 years almost. And like with COVID, everything became virtual. And so I kind of had this idea of I did all my training with you out in New York, and it's like a very kind of like Jewish community. I'm an Orthodox Jew. So it's kind of like a very concentrated amount of Orthodox Jews out on the East Coast. And then I come back to Wisconsin, and there's not a lot. So I felt like, oh, a little bit bad about like, I'm not like helping my community and being part of, you know, my community like as much as I could. So I always kind of had the idea in the back of my mind to like somehow do something with Jewish women. And, you know, with COVID, virtual world, right? Like it just kind of like helped push me a little bit to like do something. And so I have this telemedicine practice. It's called the Confidence Kala, and the word Kala in Hebrew means bride. And the reason that I kind of chose those two words together is when an Orthodox Jewish woman is getting married, it is presumed that she has not had sex before then. Now, that isn't always the case. We all know that. But that's kind of like, I guess, the ideal standard, I should say, in Orthodox Judaism. So there are laws about, Jewish laws about when a husband and a wife are able to have sex around the time of her period. So they're not allowed to have sex or even touch at the time that she's bleeding of her period, however long that is, at least 5 days. And then they also have to wait 7 days afterwards where there's no bleeding. And then, so 5 days plus 7 days, 12 days at a minimum. Then they immerse in a ritual bath called a mikvah. And that is kind of like it's a ritual purification process. There's nothing dirty about periods. There's nothing unclean about this period. It's more just like a spiritual ritual thing. And then at that point, they are able to be physical again, have sex, and until she gets her period again. So when you're first getting married and you're like learning all these laws, because you don't really kind of need to learn them if you're not sexually active. So it's a lot. It's really just like, and many Orthodox Jewish women's engagement periods are very short, or they may have been like their dating period has been very short. And so it's just a lot to learn. And also trying to plan your wedding around your period and making sure you aren't bleeding and making sure like you've been to that ritual bath is the first time you go is right before your wedding. And so there's just a lot to kind of learn and then also kind of put together with your like period calendar too.
Sure.
Yeah. So we use, to kind of help it work out, we use hormonal manipulation of someone's cycle. We can do that temporarily. We can do that long term, but that's kind of like where I started this practice to kind of like help a kala, a bride, kind of start that phase of her life where she's like kind of needs just a little bit of guidance and also like feel confident about it, because there's not great, you know, I'd say Orthodox Judaism, the community as a whole is probably a little bit more insular and sheltered than the general public. And I just don't think there's great education like in schools and health classes and sex ed throughout a woman's life like beforehand. And so like people are clueless sometimes. And so like part of my Confident Kala is to like give a little bit of education so people like hear about things and learn about things beforehand.
I love it. I mean, this is so great. I mean, I learned a lot about it during residency and fellowship, but as you said, it's a lot to learn, and it's great for those with super regular periods who can look at a calendar and say, yep, on the 15th I'm getting a period. But we know that's really not the case for a lot of women, right? Periods can be irregular, and for a variety of reasons. You know, in my field, I see a lot of like fibroids. I see a lot of endometrial polyps. We've got women with PCOS, you know, just which is polycystic ovarian syndrome. So just a lot of other medical conditions going on that make it really difficult to track, pinpoint, plan, you know, wedding, but also like a vacation or a romantic weekend or all of these things. And so when we talk about kind of manipulating your period or tweaking your period to have some of these period-free days, I would love to talk about like, you know, women who are already on birth control and women who are not. So how do you go about approaching this for women, say, who, you know, a lot of women that you work with, you know, maybe are not on birth control, and this is the first time they are actually starting birth control, and they have this special like wedding date planned, for example. How do you approach that?
Yeah, so I really have two main questions. One is, when's your wedding, right? And if it's like 6 weeks from when we're talking. If it's 6 months from when we're talking, it becomes a very different situation. Then my other question is, are you interested in contraception? Like, do you want birth control after your wedding, after you become sexually active, or are you okay? Is your main goal just to push off the period so that you can, start your sexual life with your husband? And then like, you're fine if you got pregnant right away, right? So those are the two questions that kind of help dictate what we end up doing. So if someone has a very short engagement and they're not interested in being on any contraception, we kind of figure out, well, when is the last period going to come before your wedding? If it's like the week before, that's not great, right? Because we have to finish the bleed, have 7 days with no bleeding, then get to that mikvah immersion, and then all before the wedding. So what we can use is we use a high dose progesterone. It's called Agestin, which is the brand name of norethindrone. And some of you may know norethindrone because that's actually the progesterone in the mini pill, like if you've taken after nursing, or like a progesterone only birth control pill. It's just a much, much higher dose. And what that does is it just kind of like stabilizes that uterine lining, so it's not going to slough off at the time that you're ready to get your period. But when you stop taking it, that's like within 24 to 48 hours, that's when you're going to get your withdrawal bleed. So we can plan when we want to get the period, not before the wedding, but after the wedding, like after you've had sex. And it's also, it's nice that you can control when that bleed starts, because not everyone is able to consummate their marriage on that first night, especially if they've like never really touched a boy before and they're nervous and they kind of want to take it slow as in whatever, a few days, but to go all to nothing in one night is sometimes really stressful for someone. So it also takes a little bit of the pressure off to just kind of like control when that first bleed is going to happen. And then they stop it, and then they have their period, and then they kind of go back to their regular cycle, whatever regular is for them. They may have an irregular cycle, but they go back to regular and they're fine if they get pregnant. And then we can also use, if someone has a longer engagement period, let's say 2 months at the minimum, 3 months, 4 months, 6 months, a year, which is very unusual in the Jewish community, that you can start a combined birth control pill or NuvaRing or some form of combined method. And what that does is it kind of schedules your period. Rather than pushing it off, it schedules your period. So like a pill pack, 3 weeks of hormones, 1 week off. That week off is your period week. You can actually add more hormone days in there to push off that period week. So if someone's already on birth control because they had like heavy periods or something, or bad cramps, and they're already on it for a different reason, and they also want to have contraception afterwards, we can just move the period week around to be after their wedding. So those are the two ways that we kind of like control when that withdrawal bleed is, because a period is really just a withdrawal bleed, whether you're withdrawing from a hormone that you're taking, or if you're in your natural cycle and your progesterone and estrogen levels are dropping, that's what causes a bleed.
Yeah, great. Okay, such useful information. So you're obviously using this to plan, like, around the wedding date, like when people want to have sex, but this principle can then also be used for those who want to go away on a vacation, for example, and they want to try and avoid their period at that time. Now, what about...
Sorry.
Go ahead.
I was just going to say, like, vacation wise, it's super easy. If you're already on a birth control, you just move your pill over. Totally same concept for vacation.
Now, for women who are already on something like an IUD, for example, we often say, when you go on an IUD, now you can have some irregular spotting, irregular bleeding for the first 6 months. What do you advise in those situations where maybe someone who's about to get married was in an IUD for some other reason, like heavy bleeding, an IUD or an Nexplanon or some sort of a long-acting reversible contraceptive?
So that's not so common that someone is on something long-term, like a long-acting reversible contraception before marriage, like if they weren't sexually active. So that's rare, but in the cases where that would be, it depends, like what's your bleeding pattern like? Do you get a regular period still? Like if you're on a Kylena or a Skyla, do you not get periods at all and you're on the Mirena and you want to kind of take your chances? But in general, when someone's on a long-acting progesterone and you still can get your regular cycle or a random cycle, we use that oral high-dose progesterone temporary few-week treatment just in case you get a period close to your wedding or close to your vacation or on your vacation. We don't want to take the chance, so we're just going to put you on that oral progesterone to push it off. You don't need to use the other birth control option because you don't need to take like months and cycles worth of extra to push it off. We just use that like kind of temporary progesterone pushing off.
Yeah. And how long do you think women can be on that high dose pill to kind of manipulate the period without like spotting? Because sometimes people can be on it and then spot from that. Kind of what do you do in clinical practice? Like 2 weeks, 3 weeks?
Yeah, I usually like to start it at least 2 weeks before the expected period. And studies actually out of Israel have shown that, because it's obviously a lot of Orthodox Jews there, have shown usually around 6 to 7 weeks max of being on this, which is long. I mean, I guess it depends on how long your vacation is. That sounds like a really nice long vacation.
Yeah.
But that's really kind of, I'd say, the time frame. And also remember, like, this is a high dose progesterone, and the main side effects are really going to be like bloating. People can sometimes get a little bit moody on it. So no one like wants to be on it for a really long time. Like if you're looking for something long term, like we need to move over to what other things that are made for like daily long term use, you know. Right.
Yeah. So this is more of a temporary thing just to kind of go around.
But I'd say people are usually on it between like 3 to 5 weeks, depending on how their dates and calendar and everything works out.
Yeah, great. So, I mean, clearly you use this among the Jewish, for Jewish women who are planning their wedding, but this can be extrapolated really for people with any type of spotting and bleeding. So for those listening, I mean, if you have fibroids, if you have polyps, if you have, you know, abnormal spotting or bleeding that is very unpredictable, and you're really trying to, you know, get that weekend away or get a special day where you're period free for a special event, definitely talk to your GYN, because there are ways that you can get around this. Now it does, the one thing I do want to say, it does involve a little bit of planning. Like I just got an email from somebody that said, oh, I'm going to Hawaii, you know, in 3 days, like, and I'm due for my period. What can I do? So that doesn't exactly work because as we just discussed, it has to, you know, typically be started a couple of weeks, or really ideally even after your previous period. So if you have something like that coming up, definitely see your GYN. I would say a good like month to 2 in advance, just so you can have this planned out.
Sure. Yeah, I say I can more reliably say it's going to work if we started at least 2 weeks before. But yeah, if you're like 5 days, 3 days before, it's a little bit more iffy, and you take your chances, right? Like, okay, we'll try our best, but like I can't promise you really that it's going to stop, you know. So, and then actually in other countries they have different forms of progesterone that we don't have here, that they do start it a little bit closer to the planned or the expected bleed, but you know, I don't know so much about that because I'm here. So,
yeah. Great. Well, I mean, this was really helpful information, super useful and really fascinating. Anything else you want to say based on your experience or on this topic of kind of irregular bleeding and your period?
Yeah, and one more thing that's like kind of related to like what you do in your page is that, you know, we can try to control things, right? Like nothing always is guaranteed to work. So there is always that little caveat of, well, I'm going to do my best with you and I'm going to try with the time that I have, and but sometimes it takes trial and error, like especially if we're trying birth control, let's find the right dose for you. Let's find the right progesterone for you. Let's try the right formulation that's not going to give you side effects that you don't like. But if it's really hard to keep controlling bleeding, we have to like kind of go to your neck of the woods and be like, is there something anatomic going on that like we can't always control this bleeding with hormones? And is there something surgical going on? Is there a fibroid sticking into the, you know, uterine cavity that's causing your heavy bleeding? And hormones are not going to help as much until we take that fibroid out or the polyp out, right? So it doesn't work as well when there's a known anatomic abnormality that's the cause of the heavy bleeding. So sometimes if someone's having a problem that they've been through a few pills and nothing's really like ideally helping them with the spotting that they're having, it's time for an ultrasound. It's time for an exam. It's time for, you know, figuring out, is there something going on inside that's not just hormonally controllable?
Right, exactly. And I think it's helpful to be open to all of that, right? So a lot of times women will say, oh no, like I don't even want pills, or oh no, I don't want surgery. But as you said, if there truly is a fiber or a polyp, you know, you could, you know, dose up on as many pills as you want, but you're still going to bleed. And so just being open and having a good relationship with a gynecologist.
For sure.
I'm super surprised that, you know, even today, so many women don't have a gynecologist. So, you know, even if you have nothing going on, you just never know when something might be. So it's always helpful just to establish a relationship with a gynecologist. And so you can always reach out, you know, should you need something.
Perfect.
Great. Now, where can people find you if they want a consult, other than, of course, seeing you in Wisconsin? But tell us a little bit more about that.
Yeah, so in person, I'm in Wisconsin. So I don't know how many at least I don't have a lot of followers in Wisconsin. I know that. My website is TheConfidentKala.com. You can find it on my link tree on my bio here. If you see my website, it's definitely geared towards like Jewish women and educating them, but I honestly, in my in-person practice, probably 95% of my patients are not Jewish, so I'm fully comfortable seeing any woman, and you know, just to kind of do that planning and kind of figure it out, and so it's a very easily made appointment, like through my website, and I post my hours every week, but I'm definitely like bookable, you know, out more than a week. I usually have evening hours because I do have my regular day job, and sometimes on Fridays and Sundays as well.
Great. And I know you're licensed in a few states. So where can patients, because obviously you have to be, in order to see Dr. Hellman, you have to be in a state that she's licensed in. So tell us about that.
Right. Yeah, and so I can't prescribe anything if you don't live in a state that I have a license in. So I have a license in Wisconsin, of course, Illinois, New York, New Jersey, Florida, and California. So,
oh, great.
Yeah.
Awesome.
So I kind of, like, when I was doing that, picked like state, and I hope to add more, but like states that have generally larger Jewish populations. So people keep adding them as we go along. So, but yeah, California is one of them.
Oh, that's wonderful.
Yeah.
Well, it was so great chatting with you. I'm so excited about all the work you're doing, and glad that we reconnected after all these years.
Yeah, and good luck to you with your new practice. That's so exciting.
Thank you. Yes.
I love seeing like great women doctors like do their own thing and just like spread their skills everywhere. So that's great.
Yes, absolutely. Yeah. Well, thank you so much, and have a great evening, and we'll be in touch.
Yeah, for sure.
Thank you, everybody. Okay, bye.
Right. Bye-bye.
Bye. Bye.